So this next session is business continuity planning for cultural institutions. It is presented by Ann Richards. Ann is the Security and Risk Program Manager at the Minnesota Historical Society. Her interest in museums began with achieving a master's degree in international cultural heritage management from Durham University in Durham, England. Ann oversees the Security and Risk Program, which includes risk management initiatives, cultural institution security, business continuity, and policy development. Ann is a certified institutional protection manager and a certified public sector continuity professional. She is enthusiastic about providing cultural institutions with a sustainable future through the preservation of collections, historic sites, and the natural and built environment while encouraging risk management and security initiatives. So that wraps it up for my introduction to Ann. Ann, I'm going to turn it over to you to do the presentation. Ann, thanks for joining us.
Yeah, thank you. Thanks for the introduction. Yeah, as Todd said, I am the Security and Risk Program Manager for the Minnesota Historical Society. I'm just going to pull up the screen there and switch over. So I've left my email and my phone number on here, so please feel free to reach out after this presentation if you have any follow-up questions or looking for additional resources. I have about 4+ years of experience in business continuity planning specifically. This started out at the state of Minnesota. We used our relationship with the state to help develop our own plan, use our resources, and kind of begin working through networking. I'll speak about that a little bit later about the importance of networking and kind of sharing experiences as we go forward. So the agenda for this session, I'm going to talk about what is a business continuity plan, why is it important, what are the plan phases, so from development to response and then to recovery, kind of fills up that whole gambit of some sort of continuity event plan. So then I'm also going to talk about a little bit of the difference between the business continuity plan versus disaster recovery plans. Within the disaster recovery plans, I'm kind of coupling as well emergency response plans. And then the COVID impact and business continuity response. So how has MNHS's plan helped with our response, and then what have we learned actually from this going forward? So a little bit of background, a continuity event. So this is kind of a similar terminology for incident, and actually further on at the end with our resources, I have a link to some glossaries about business continuity planning, because there's a lot of different terminology depending on the field that you're in, and how you define and use certain terms for business continuity. For our purposes, I'm going to use the term continuity event, and I'm defining that as an interruption, disruption, or loss related to some aspects of an organization's business operations. A continuity event, the definition is scalable. So that's based off of the loss associated with the event, whether that's financial, reputational, kind of employees, so your personnel loss, IT loss. These are all different types of loss that you can have. And then those are also scalable based on the amount of loss. Normally with business continuity plan, people are looking at financial loss. Generally, if there's any sort of continuity event that affects personnel, IT, the facility, it's always coupled also with a financial loss to the institution. So what is a business continuity plan? A business continuity plan is a documented collection of procedures and information that's developed, compiled, and maintained in readiness for a continuity event. Developed, compiled, and maintained, that's where all of the work is that goes into business continuity plan. There's a lot of, with policy development, and this is the same, I say, you know, the actual development of the plan, the writing, putting the words on the paper is the easiest part. Getting the actual testing and training and information gathered beforehand is the difficult part. So I'll talk about how we can make that a little easier going forward. Why a business continuity plan? So a business continuity plan ensures that a cultural institution or business can continue to perform its essential services during a wide range of continuity events that impact the normal operations for the sustainability of the organization for future generations. So In the past, when we've talked about business continuity planning, I've set the scene and kind of asking people to imagine putting themselves into a continuity event, whether that's a hurricane or a tornado that affects the facility, or it's a fire. Generally, those are the type of more probable events, but now we're all in a continuity event. We are all being impacted by COVID-19, and so if we frame that, I'm just kind of framing ourselves in this institution, and it's going to be a little bit of a different look for business continuity planning in the future. And I'll speak about that later on too. So a plan phases. So when you're working on the plan, there's the planning and development phase. This is going to include creating a team or assigning one individual who is responsible for managing this plan for the actual development of it, pulling together the resources, the procedures and policies that need to be in place. I recommend that includes HR, IT, leadership, risk, safety, and communications if you have those areas, or if someone wears all of those hats, they're an important part of the team. Look at how this impacts your employees. So there's going to be HR policies and procedures that need to be developed. Specifically, one that we look at is a teleworking policy. So how can the workforce move quickly to an alternate work location or alternate work duties? Leadership buy-in is particularly important. It takes a lot of work to develop a plan, and a lot of problem solving, especially if there's lack of resources or funds to put the IT capabilities in place for teleworking or for an alternate facility. So having that understanding that this is a large project, leadership supports this, and they support the need for potential resources for maintaining a plan. The next part of a development phase is going to be a risk assessment, business impact analysis, and then mitigations. There's a lot of templates out there for risk assessments and for business impact analysis. Risk assessment looks at the full organization and what are the risks identified on a likely basis to the amount of the hazard. So it's the impact versus the probability. And right now, I can say we've been working on an internal risk assessment at MNHS, and I will say we did not have pandemic on the list. And I would argue to say that a lot of places, when they think of pandemic, they think of employee loss of employees with flu outbreaks. Especially here in the Midwest, that's generally the more probable pandemic event that we're going to see. So I think pandemic planning is going to be on every single risk assessment now going forward. And with that risk assessment, you identify the highest risks are the ones with the highest impact and the highest probability. And then you prioritize that for mitigation efforts, whether or not there's a low cost. So if it's a high impact risk, high impact or high probability, but it's a pretty low cost to mitigate that risk, or there's a control, whether or not that's an insurance policy or it's putting some sort of policy and procedure in place. Those are generally the risks that you want to check off first. And then a business impact analysis is going to be, how do we look at the functions within a business and then identify what the impact would be if that function no longer existed. So that's how you're going to be able to tease out what functions are considered essential. Generally, admin functions are considered essential for a business because that's your payroll. That ensures that you've got HR, you've got people, payroll, and IT. Generally, those are needed to make sure that your business can continue, and then filtered from that, essential services based on mission, core values, etc. Then the response phase, that's going to be, how do we respond to a continuity event? That's where your emergency response plans, your disaster recovery, and crisis management comes in. These are generally considered appendices to the plan. So if you have any changes to emergency response, you don't have to change business continuity. You just have those plans in place to respond to the continuity event. And then the recovery phase is when you're recovering to a normal operations. So I'll talk a little bit more about the distinction between emergency response and business continuity, but you can see here that it really fits into just one area of business continuity planning. And then the recovery phase, this generally is a time recovery, they call recovery time objectives. And this is how long it takes for a certain function to recover after an event. These range from 24 hours up to 3 years. So depending on the function that you have, this is all going to be identified in the plan, and it helps to prioritize funding and response initiatives going forward. So relationship between managing disruption-related risk, this is the plan and prepare, response, and recovery. This kind of shows where it all fits in again, based on a disruptive event. So we're monitoring and we're reviewing, and then we're also including communication during this entire part. Communication is really important. I want to stress that. Communication to leadership, communication to everyone on the team, and then to all employees so that they know what to expect if a continuity event were to occur. So for the plan and development phase, I went into this a little bit more detail in the beginning, but here's a little bit more information about the what steps you want to take in the way you want to take them. So I recommend conducting a risk assessment first. There's some really good resources out there on nonprofit risk management, which is a website, and they have certain templates. You can also pull templates from United Way. And then also online, you will find templates for risk assessment everywhere and for business impact analysis. My recommendation is that you just do some research, find some templates that make sense to you and your area and to the organization, and then you can tweak those. There's really no right or wrong answer with it. It's really about the results that you get. So if you have actionable results from a risk assessment and a business impact analysis, then what you used was helpful in getting there. Because of those two, then you identify and prioritize essential functions. Essential functions and essential services are generally interchangeable when we're talking about a business continuity plan. And then based on that, you identify what necessary resources are needed to continue those essential functions. So what are the personnel requirements? What are the technology requirements? So that goes into teleworking. Are people able to telework, whether or not they have equipment at home, whether there's reliable internet, and policies in place that identify, if someone gets hurt at home who is working, what does that mean for HR policies? And then also facility requirements. Right now, facility requirements isn't as big as a thing because we've all scattered to our homes because facilities are not being used. But generally in a continuity event, we're thinking about natural disasters as well. So it's good to have an idea of what an alternate facility might look like, where you can pull staff to work from the essential services to continue the job functions and continue the organizations to pay staff who are responding to this continuity event, to communicate to external and internal stakeholders in the event of this continuity event. So there are some things to think about. It takes a lot of planning, but it takes a lot of, I think, problem solving too from MNHS's side. We don't have unlimited resources, and we have to be pretty flexible in our response and thinking about what services and what capabilities do we have right now if the event were to happen tomorrow. And then there's also, it's good to have goals in the future for a continuity plan, but it's more effective if you're looking at actionable ways for tomorrow. So I always tell people to kind of frame that scope of their plan into what could happen very quickly and what could happen tomorrow. So here's some essential components of the plan. So within a table of contents of the actual written document, these are the areas that we highlight. These are pulled from what we've got in our MNHS plan. I'd be happy to share what those table of contents look like. We've used a lot of the resources from FEMA to create that plan. So you'll find these table of contents and these essential components basically in any sort of business continuity plan template that you find. Like I said, we talk about essential services or functions. Essential records, this is really important on for response. Basically, do you have your emergency response procedures? Are those available online? Are they available at an alternate facility? Are they available to the staff who respond, whether that's on their phone or on a tablet? So it's really helpful to have things both in paper and in the cloud for response. Because if your facility and it's in paper and you're all pulled out of the facility because of a flood or a fire, those essential records are pretty much unattainable at that time, and it makes it very difficult to respond to a continuity event. Orders of succession, this and delegations of authority, this really comes into play with personnel continuity events. So pandemic planning, whether or not someone is ill, there needs to be some sort of succession, and then authority identified with that person who can either continue a certain essential service or the organization in general. I mentioned alternate facilities. This one is really to prepare for if your facility, your main workspace facility becomes offline. A lot of places are turning towards telework now, actually, rather than having an alternate facility. It depends on your IT capabilities. So if your network's in the cloud, if your network is accessible from home, then an alternate facility may or may not be needed. Communications, that's going to be to external and internal. If there's a continuity event and you're in the news, you're gonna have questions. You're gonna have people asking on the door. And one of the main parts of responding to an event is to have one clear message to both your internal and external stakeholders on how you're responding and what the impact is. So working very closely with communications is a big part of this too. And then testing and exercise. That identifies once your plan's in place. How do we make sure that it's sustainable and we can maintain this plan? Testing helps to identify gaps within your plan. So once you have your plan, testing is what we call for the IT capability. You test whether or not a person's laptop will work at home, or you test whether or not you can connect to the network. We have several systems that are only accessible on our network, which is facility-based. It's not cloud-based. So we have to have some sort of log me in or VPN to get into the network that's very locale at the building. So we test that to find, okay, we couldn't actually access this one software that we thought we could. And then we make changes in the plan going forward. Exercising is for the people. So we call these, there's a tabletop exercise, which is really helpful. I've got plenty of templates for this, both in emergency response and for business continuity planning. An exercise is, we could do it actually virtually too. Now, previously it was you would get everyone in a conference room or around a table, and you'd have a scenario, and you would walk through the scenario in this low stress environment to go through your plan from step by step. And from that, you would also find out any gaps that are needed to be fixed within your plan, or things that needed to be considered that weren't considered beforehand. So you take yourself through the scenario, but in a low stress environment. The last thing that you want to do is find out that there are gaps in your plan once a continuity event is here. But there will always be room for improvement as well. So that's where flexibility comes in too. And then the recovery. So you talk about recovery time objectives for essential services like IT. These are all based off of your impact analysis. So for example, at MNHS, if we have payroll, for example, your recovery time objective is going to be based on your pay period. So 15 days. So there has to be a 15-day recovery time for that payroll system to be up and running. If it happened on payroll day, that's going to be a 24-hour need to have that recovery time objective come up to mitigate that loss. Otherwise, there's a loss with the payroll. The other things that, as an example, is kind of IT. If your email goes down, that's probably not as high priority because you can use telephone, you can use other ways of communicating. But if it's a essential software that goes down, that might have a larger impact. So looking at each one of those areas and identifying when this needs to recover helps with planning for that recovery. So the response phase, this is when a continuity event begins. We call that activation of continuity procedures and emergency response plans. There is a very, very helpful, actionable triggers and activation sheet. There's plenty of them out there, depending on the type of event that you have. I'll use the COVID as an example of how we responded at MNHS. We turned the dial just like everyone else did, where we kind of started looking at those higher risk areas with programs, large events. What could we do then? And then we started looking at teleworking, and then we started looking at closing in general. And we were looking at these things prior to like guidance from the governor. We were looking at peer institutions and seeing what they were doing. And that would be different phases within the activation. So you can go from like a partial activation of your plan to a full activation of your plan. And we're currently in full activation. So that means all of our essential services are prioritized right now. And that includes facilities, finance, IT. We have staff teleworking. So that's fine. That's part of the plan as well. And the response phases, we actually had kind of a triggers and activation sheet where we were just checking off external triggers and internal triggers saying, you know, okay, there's this many cases, we should consider this, or school field trips have been canceled. How does that impact what we're able to provide as a service? So looking at what those factors were and then making decisions based on that, and having that in place beforehand really helped with that response. Let's see. The ongoing activities. So responding to business continuity event, this is a definition of response. So this is the immediate and ongoing activities, tasks and programs and systems that we manage the effects of the event. So this is where your emergency response plans come in, where your disaster recovery plans come in, especially with collections. There's generally what we call a response team, and these are going to be figured out within your emergency response plans. Of who's responding to what and what it is specifically. Here's a little bit of a distinction between the business continuity plan versus disaster recovery. So the business continuity plan is very proactive. So it helps to plan prior to the event. Disaster recovery definitely help you have that in place before the event, but you react to a continuity event rather than proactively planning and having stuff in place no matter what the event is. So that's the distinction there. The COVID impact. So I talked a little bit fast, but I know there will probably be a lot of questions. This is how we responded at MNHS. We've got, like I said, we've been working on it for about 4 years. We don't have a specific plan already in place. We had a lot of our policies and procedures in place. We had our teleworking consideration. We had just completed about 2 years ago the business impact analysis. We've identified essential records and what software was needed to have those essential records in place. We operate with Google. So our actual business operations for communication, for file saving, mostly is on Google. But we have to think about all of the other software that support the services like our collections, digitization, payroll, our employee system, our payroll system. All of that stuff isn't necessarily on the cloud. So we had to kind of look at each one of those areas and identify how we could either access them and also continue to provide that service without being in the building. We ended up getting a VPN type of software or like LogMeIn where we could access our computer in the building. And that has helped greatly. And we prioritized rolling out that software to the staff who were considered essential or performed essential duties. And then from there, we were able to provide that going forward. But in doing so, we made sure that we had that foundation in place for our admin functions, for our emergency response, for safety and security, before we were relying on the rest of the telework capabilities. So that was kind of prior. We've been working with the state. Like I said, in 2015, there was an executive order that required all state agencies in the executive branch to have a continuity of government plan. So that's another one of those terms that you'll see going forward is continuity of government. That really affects, of course, government. You'll also see continuity of operations. That's basically the same thing as a business continuity plan. They're interchangeable at this point. And with the continuity of government, we were invited to tag along with the work that they were doing, and they were creating lots of templates and working through questions in a group that were that we didn't necessarily think about. So having that relationship and that networking in place really helped with the development of this plan, especially when you could say, you know, we ran into this roadblock. How did you respond to this? And one of those was actually the teleworking. So we ran into a roadblock with the telework policy because we don't necessarily, before COVID-19 happened, we didn't have a LogMeIn or a VPN widely used or widely identified for essential services. So that was something that we had to do pretty quickly in probably about a week before we went to teleworking for our staff. But it was something we had already thought about. So even though we don't necessarily have the full plan, we've got all of that actionable stuff ready to go. And that's what you would have in appendices. You can have it either in your full plan or in your appendices. The way that we've decided to do it is to have the kind of list of essential services, list of records, our communication plan based on what the impact was, our orders of succession, our, let's see, delegations of authority. We've got the incident response plan. So who's kind of overall identified as the people who would have the responsibility to respond to an incident. These are all stuff that we've included in our appendices because then we can separate those as confidential information and have the plan be more of the high level guidance and principles of what we're doing based on those essential records. So saying, we've got these essential records in place, we've got a list of it, we can, this is where they're located, and then we actually have a list of what we deem as essential records in our appendices. So it goes into a little bit more granular detail. For the response phase, we had this triggers and activation spreadsheet. We created a pandemic plan very quickly based off of the recommendations from FEMA, I believe, and from the state. So pandemic plans have been in place because of the flu and for other and SARS and other things like that. We did not have one specifically before COVID happened. So one of the things I was tagged with and have been working on since March, the beginning of March, is the response to COVID for MNHS. And part of that is identifying what our guiding principles are, identifying who's on a response team, and working through that triggers and activation spreadsheet. So the triggers and activation spreadsheet for COVID specifically was something that we created probably in the beginning of March because we knew that we needed to have some sort of plan in place and how we were going to react to this, and a way that we could look back on. And now actually we're turning the dial a little bit more the other way based on any of the governor executive orders. So we're able to kind of go backwards now based on that and what comes out as guidance from CDC, from MDH, depending on what needs to be in place for that. So those are the two things that were very, very helpful going forward. And these were things that we pulled from the development of our business continuity plan. There's templates out there for triggers and activation. There's templates out there for tornadoes, for hurricanes, for natural disasters, for IT. So you'll find a lot of information. I would say, especially now with COVID, there's going to be a lot of resources out there. It might be a little bit difficult to sort through and sift through, but go with your gut something that looks like it'll work for you and you can tweak it a little bit, go with that. I wouldn't recommend trying to fit our services and what we do in the cultural institutions into kind of a for-profit type of business continuity plan. These are across the field, and they're just kind of beginning to make their way into the museum field right now. 2 years ago, I presented on business continuity planning at AAM, and before that presentation and before that AAM conference, there wasn't really any information about business continuity planning that AAM had pulled together. It was more about the disaster recovery for collections and emergency response and things that were required for accreditation. Now you'll see guidance on business continuity, how to develop one for a museum, how to develop one for cultural institutions in their website. So it's membership content. I wouldn't say that that's the only place that you can find this information. I've linked to the UK because they had this a while ago. So I was actually finding most of my information and helpful guidance about 4 years ago from the UK's area. And they have an information page and plans and templates for museums and cultural institutions on their media and sports page. So that's linked at the back of this presentation. So I would say just use the resources that are out there, but use it to your advantage and tweak it. It's flexible. It's your plan, and it's what works for you. The recovery phase, right now we're actually currently planning for recovery. We're still, I would consider, in our response phase and a recovery phase. The response phase started about, March 10th. And in about 4 days, we had to make all of these really big decisions. So having that triggers and activation spreadsheet was very helpful. The recovery phase, we're now looking at and waiting. We're trying to plan before any of these different questions come from the executive orders. When can we start having people gather in large spaces again? What's the facility modifications that need to be in place? Who can go back to work? How does that relate to teleworking? So we're going through all of these questions right now. And we're working on the executive order from Governor Walz that it's Executive Order 2040. And that is identifying the need for a return to work plan for any businesses that are returning to work. We are working on that right now. And we're currently in, like I said, our continuity of operations phase right now. Essential services are what we've deemed we've got a list of who are like providing those essential services. And then of that, who has to be on the site to provide collection security tours or security for the building or facilities maintenance, like our HVAC and boiler license. So we have that identified right now. And now we're looking at once the governor loosens restrictions, who's that next group of people that have to go back into the office, who cannot continue to telework, and what do we need to have in place for that, considering facility modifications and if there's a way to have social distancing in place, what do we do for break rooms? So we're currently planning for that right now, and we're using the information that's coming from MDH and from CDC, and we're kind of applying that to museum field, and we're really waiting and trying to anticipate what might be the next phases coming down from the state based off of how they turn the dial to go to the stay home order. So looking at it on a little backwards way, so that we're thinking about these things and preparing a little bit further in advance than we were able to at the beginning of this, because this hit very fast and very, very large impact. So what's next? Everything's really uncertain for everyone, the economy, small businesses, and especially for cultural institutions. I would say it's the time to be flexible, to be positive, and to problem solve. We're getting from all range of fields, people with kind of these innovative ideas are coming up to solve a problem. How can we turn to virtual? How can we provide access by maintaining social distance? Can we do virtual live tours of a house or our collections areas on Facebook Live or Instagram Live? So how can we get our books online with ebooks? So there's a lot of work being done, I think, to not only respond to this, but also to have a very different look for how we are making our spaces more accessible just for the wide range, right? I think beforehand there was questions and plans about trying to be more accessible on the locale, right? And cultural spaces were very local based, whether or not it's a building of a museum or it's a site, it's a historic site. It's very much people come to this space, in the physical space. How beforehand there were questions about, okay, how can we get our collections digitized so that people know what we have, that's maybe not on display. And so these questions and conversations were happening beforehand, and I think there's a very exciting opportunity to continue those conversations that will have a win-win situation. You'll not only be able to prepare and provide sustainable services in the event that COVID lasts for a long time, but you're also preparing for kind of the next wave of how people are looking for information in general. What I've learned from this, and I think particularly we in MNHS have learned from this, is that preparation is important. Flexibility and positivity are utmost. So even if you haven't prepared fully, flexibility and positivity are what's going to move things forward and what's going to actually keep everyone in good spirits and motivated to continue to respond to an event. We're finding that we're constantly, I'm working nights, evenings, and weekends in kind of preparing for the response to this and then to recovery. There hasn't really been any slowdown from this. And I know being in the calls for the state, there's a lot of people who are working 7 days a week with MDH. Everyone's trying to prepare and respond to this in a way that we're able to build back our economy and build back these services that we had. So flexibility and positivity are definitely very important going forward. I've also learned to record everything. So even right now, even if you didn't have a plan, recording what conversations you had, what decisions were made, at what time, and what were the triggers that you made this decision based off of? What are the ideas? Are there processes that are changing? Are there procedures that are changing? I know during the response phase, it's very difficult to also record, but it's also very important. So whether or not that's just a note on a sheet of paper that after this is all done, you look at and compile and redo, it's very helpful going forward, especially if you don't have a business continuity plan in place yet, to look at these because we're in a continuity event right now. You're responding to a continuity event. You're actually, in a positive way, gonna be more trained and skilled in the idea of business continuity planning going forward. So if you write these down, have these decisions and plans and ideas in place, you can, once there's a lull, start to build that into business continuity planning for the future. I say for us, I'm recording everything on Trello. I don't know if you have Trello. It's basically a very glorified sticky note list system where you can attach certain files to. So I've just been jotting down notes, and a part of my job, and after this happens, is to do a review of what our response was, and then to build that into our continuity plan going forward, so that we have identified, there's some gaps that we've run into. We kind of didn't. There's some areas for improvement for sure on things that we didn't necessarily think about because we weren't really looking at a pandemic. We were looking more at IT network failures and fires or floods for the impact, because those were the higher impact and a higher probability. They were probably medium impact compared to this COVID. Actually, they are medium impact compared. This is a very, very large impact, and one that business continuity planners are a little bit aghast at. Generally, the scope of a pandemic or an outbreak is localized on either a community level or up to a state or country level. In my experience and all of the research that we've done and all the plans and the networking that we've talked about and what to prepare for. Global pandemic was never on that list. And I think that presents in and of itself really unique challenges for supply chain. And how do you respond to this when everyone's responding to this? Whereas if it's a tornado, it's very local, your community is affected, but you could have, other communities come in and provide assistance where everyone's kind of responding to this, and there's not as much capability for assistance right now. So I would say I would just leave you on the note about supporting each other, being kind to one another. We're all going through this. We're all kind of problem solving and thinking about this going forward. And I think it'll be a long time until things are back to whatever this new normal becomes. But in all honesty, as it relates to business continuity, I think this will provide an opportunity to have business continuity and in the cultural and museum fields right now. And I think it'll become much more of a known thing in our field going forward, and also in just in general for small businesses. This will not just be for the banks and the investment industry and IT world. It's going to help small businesses. It's going to help cultural institutions remain for those future generations. That is in our mission. So here are some of the resources. I mentioned the AAM business continuity resources. So that I mentioned, it's login. If you're a member, I hope, if you're not a member, let me know and I can try and share other museum stuff that is helpful. I will say I think they direct you to FEMA as a resource, and then also to local governments, because FEMA has the massive inventory of resources. It'll be a little bit overwhelming when you look at FEMA, but sift through it. That's why I didn't provide a link specifically here, because there's a lot there that you can jump around to, and there's a lot of good graphics. There's a bunch of checklists and planning, and there's also a lot of information and templates for business continuity or business impact analysis going forward. Ready.gov also has a lot of good information. That's that third bullet point. And then I also linked specifically to their business impact analysis on ready.gov. The UK.gov business continuity planning for museums and galleries. I've linked that because that's really helpful. And then I also put this Disaster Recovery Institute International, their glossary. The DRI is where I completed that course to become a certified public sector continuity professional. They have a lot of information on there as well, and a lot of helpful stuff for that public facing sector. I'll go to questions.
So we have a couple of questions here. One from Elizabeth. I think you may have answered this question earlier with your response on MHS using the virtual private network, or VPN.
Yep.
Her question was, the organization is really comfortable with storing emergency plans on the cloud. Is there anything additional you wanted to say to that?
Yeah, so we've actually, 2 years ago, we noticed, because with MNHS, we've got our site network, we've got over 33 buildings, and we kind of manage 13 of those, or 14 of those owned and operated. Those ones with 14 different emergency response plans, they were all different, and they were all housed in different areas. So one of the things we did a couple of years ago was put those emergency response plans on the cloud within our Google Drive. So we have the Google suite for MNHS's operations, and there's shared drives within that. So anyone that you share that within mnhs.org, so with our company email address, has access to all of the emergency response plans for the sites. Because not only do you want it to be accessible to everyone, we have people who travel from site to site and know then that these are accessible in that one area, so they don't have to remember multiple places. And yes, we are comfortable with those on the drive. Generally, files, what can be saved on the drive, we've been told by IT that Google Drive is secure for those purposes. So, yeah.
Okay.
Mhm.
We have a question from Kathy. Excuse me. From sometime in the future, could business continuity planning be its own workshop?
Oh,
So
sure.
we could all dive deeper into this.
I'd love that. Yeah, I'd be more than willing to help that. I think it'd be a great way to practice kind of those different areas of your plan and maybe working through a business continuity plan. I think that would be, or business impact analysis too. I'd definitely be willing to do that.
Okay. Any other question? That's it. We have